I'm Dr. Dana, and this is a video podcast for women who live with leaky bladders. I'm going to show you that you don't have to suffer in silence anymore. Embarrassing in private. More than 10 million women suffer in silence. Spending nearly $1 billion annually on protective products, many women with incontinence simply live with leaking, unaware of some very simple steps that they can take to end their silent suffering.
Secret, shameful times where I leaked, I laughed, and I kind of lived with moist underpants, and it's not something that you want to tell your friends about or anybody, and it began to really affect the quality of my life.
It's embarrassing to walk around and feel like you need a diaper. It's gross.
Sound familiar? If so, you're not alone. It can happen to women who have had children, and it can happen to women who are menopausal. In fact, it actually happens to 1 out of every 4 women between the ages of 30 and 59.
I have 4 children, 3 girls and a boy, and the first one was a little traumatic. The second delivery was really traumatic, and I think that was the beginning of some of my incontinence problems.
I thought incontinence just happened to all those girls that had those babies, and I wasn't one of the ones that had babies. I have never had it.
Women with incontinence are often too embarrassed to mention their problem to their closest friends, their family members, and even to their doctors. Part of the reason for their silence is that many women just aren't aware that there are actually professionals out there who specialize in female incontinence and are truly dedicated to helping leaky ladies. Dr. Denise Elser, a urogynecologist in the Chicago area, sees women of all ages for a variety of bladder problems.
In urogynecology, we study pelvic floor disorders. So any bladder, vaginal, sexual, or rectal function would fall in our realm. Some of the patients I see range from all ages, and this week I saw a 4-year-old and a 98-year-old. And women will come to us with problems from either they can't hold their urine, meaning they leak when they don't want to, and that can range from stress incontinence, which typically we describe as leaking with physical stress on the bladder. When you cough, sneeze, lift something, jump, bend over, and the urine squirts out. Or the urge incontinence, where women have that feeling of gotta go and can't get to the bathroom on time and can't get your pants off fast enough and can't sit down. Then we see women with urgency, frequency, or irritative symptoms, where they feel like they always have to go. When I see women with incontinence, the variety of things we can offer her range from what we call behavioral therapy or non-surgical therapy, to medication, to in-office procedures, to surgeries.
Often patients get relief from their leaking without medication or surgery. Instead, they seek the help of a physical therapist that specializes in rehabbing women's bladders. Dr. Jill Matias is a women's health physical therapist in the Chicago area.
As some people know, physical therapists don't only treat shoulders, knees, feet. There are some physical therapists that specialize in treating women's health issues, such as pelvic pain and incontinence. In physical therapy, if you are being treated by a women's health specialist, we can treat these without surgical intervention. We can use biofeedback, which is here, and we can do exercise for the pelvic floor to strengthen the pelvic floor, or if the problem lies with the pelvic floor being too tight, relaxation techniques to decrease the tone of the pelvic floor. We also teach patients to engage in behavioral modification.
Now, behavior modifications might sound a little ominous, but don't let that scare you. All that really means is avoiding things that are going to irritate your bladder. Things like caffeine, which would include coffee, tea, soda, and chocolate, citrus fruits and juices like oranges, grapefruits, and tomatoes, spicy foods, alcohol, and even tobacco. So whether your leaking is caused by bladder irritants, menopause, or childbirth, I want you to know that there is no amount of leaking that's considered normal, and there is help out there for you. Remember, there are doctors and physical therapists that specialize in treating ladies that leak, and these specialists will rehab your bladder so that you can once again laugh and sneeze with uncrossed legs. You can run around with your kids and go for long walks without the fear of embarrassing accidents. To find a doctor or physical therapist near you that treats female incontinence, you can go to a couple different websites. The American Urogynecologic Society at www.augs.org, and you'll click on the Information for Women button at the top of the page. Or you can go to the American Physical Therapy Association website at www.womenshealthapta.org, and you'll click on the Consumers button at the left-hand side of the page. I'm Dr. Dana, wishing you good bladder health and dry undies.